Welcome to Orange County Power Players, where we spotlight the personal, professional, and financial success stories of OC's top leaders. Here's your host, Danny Flores.
Welcome back to OC Power Players, where I interview some of the most successful people in Orange County. I'm Danny Flores, your host, and today's honored guest is Dr. Raoof, zooming in from Newport Beach. Dr. Raoof is a distinguished cataract, LASIK, and Conreal surgeon at New Vision Eye Centers in Orange County, California. She is internationally recognized for her expertise in femtosecond laser-assisted cataract surgery, advanced intraocular lens implants, and all laser refractive procedures like LASIK, SMILE, PRK, and EVO ICL. Notably, she was the first U.S. surgeon to implant the Clarion panoptic trifocal lens. Dr. Raoof earned dual honor degrees in cell molecular biology and Near Eastern studies from the University of Michigan, followed by her MD in ophthalmology training there, serving as chief resident. She completed a prestigious cornea and refractive surgery fellowship at Harvard's Massachusetts Eye and Ear Infirmary, where she was chief fellow. Welcome, Dr. Raoof.
Thank you. Thanks for having me.
That's pretty impressive what you do and giving, I guess, people's vision back or improving it. Tell us a little bit about that and how you decided that's what you wanted to do.
I knew I wanted to pursue medicine since high school. I grew up in a home where we loved science, loved biology. Both my parents were physicians. Never pushed me to go into medicine, but just encouraged me to explore my highest potential and pursue what I love. And I just happened to fall in love with science and biology. Moving on into college, it became pretty clear to me that medical school was the path that I wanted to pursue.
Mm-hmm.
So I ended up at the University of Michigan for medical school. And during my first year in medical school there, I had the opportunity to observe an ophthalmologist performing cataract surgeries. And that day was a transformative experience for me. I was struck not only by the precision and elegance of the cataract surgery procedure, but also by the immediate life-changing impact that it has on patients and their lives. And sort of witnessing that vision transformation restored pretty much in real time sparked that deep sense of purpose in me. And I knew at that time that ophthalmology was the path I wanted to dedicate myself to.
Well, that's very interesting how it, sometimes we don't know what our dreams are. We kind of just fall into them. And you had that one procedure that just kind of turned on the light bulb and said, this is it, right? It's just finding that. And that's a really cool thing to have, because many of us search through life for those little light bulb moments that guide us in one direction or another. And to see that early on, and then you continue with that, gives you like a nice runway to become very proficient in it and be able to help patients, I guess.
And it's quite a long road from that moment forward. I completed the 4 years of medical school, followed by a year of internship that was in general surgery and internal medicine, followed by 3 years of ophthalmology residency, and then followed by 2 years of additional subspecialty surgical training in cataracts and refractive surgery and cornea. And it's really that passion that we're talking about that made me remember why I'm doing all of this every minute of that path. It's a difficult, long path, but it was well worth it. And now doing what I do, I appreciate that every moment with every patient, every surgery that I do. And it just really gives my life so much meaning.
Now, you mentioned a lot of 1 year, 2 year, 3 years. What's the total time span to become like proficient?
14 years.
14 years. Wow, that's a
Yeah.
dedicated time. And that's 14 years out of counting out of high school. So say from 14 years forward.
Yeah, so it's 4 years of college, 4 years of medical school, 4 years of residency, and then 2 years of fellowship. So actually 15 years.
Okay.
15 years
Wow.
since graduating high school.
Wow. Yeah, that is, and that's like that's hardcore studies, right? It is not like
It really is.
Yeah.
Yeah. I mean, I'm sure, from speaking to other physicians, medical school is quite intense. The path leading to get into medical school involves a lot of hours of studying and preparation. And then once you're doing your residency and fellowship training, it is on-the-job training, basically. And for example, in my fellowship, I was easily working 80 hours a week, but it was all hands-on learning, doing surgery, studying. So no question, it's a long road, but it is very worth it. And I have never regretted going that path.
How many surgeries did you have to do a day during that time?
So initially in surgical training, you start nice and slow. And for example, in ophthalmology residency, the first year, you only really do a few surgeries a week. And as you build up your skill and your confidence, then you ramp up higher and higher. By the time you're in your last year of ophthalmology residency, you can be easily doing, 20 surgeries a day.
Wow, 20 a day. That's impressive. That's a lot of eyeballs there.
Yeah. It does take some stamina to perform and focus. And cataract surgery is so intricate. It's all done through the microscope. I use both my hands, obviously, and also both my feet, utilizing foot pedals, and all done through a very highly magnified microscope. So the procedures are quite detailed, require lots of focus, but that's where excellent training is key.
Right.
I was very fortunate in my life to have wonderful mentors, wonderful surgeons that taught me along the way. As you mentioned earlier in my bio, the University of Michigan was really where I found this passion and had so many great mentors. And then when I went to Harvard in Boston, I mean, it was a whole new universe of excellent mentors and rigorous work where I got to really refine my skills.
Now you said you have foot pedals in your hands. Are you sitting? I would imagine you're sitting.
Yes.
You can't do the foot pedals standing. I
Yes.
guess.
Yeah.
And so is that like anybody who wears glasses can actually get this done?
So the two main surgeries that I perform are cataract surgery, which is a procedure where we replace the natural lens that's in somebody's eye with a clear new lens implant that improves their vision. And cataract surgery is typically done on people in their 50s, 60s, 70s, and up, where they develop this natural clouding of the lens that's inside their eye. It's a normal part of aging. So they start having blurry vision despite wearing glasses, and they have problems at night like glare, starburst, or halos. So this procedure, I remove that cloudy lens and put in a new lens implant. And I also have the ability to use different kinds of lens implants. And many of those lens implants are able to get patients to no longer need glasses. So
that means you can fix cataract and any need for glasses at the same time.
Exactly.
And so, but cataract, from my understanding, it starts setting in very slowly, right, as you age.
Correct.
And what's is there a way to try to prevent it or slow it down?
Not really. And I get asked that question all the time by patients. It's a normal aging process. I tell them it's like getting gray hair or wrinkles. It's a normal physiological biochemical process where that natural lens gets cloudy over time. And you're absolutely right. It's a very slow, gradual process that happens over the course of years for most people. There are some situations where the cataract can develop quickly. And that's rare, but I have seen young patients as early as late 20s or even 30s that have cataracts that can be congenital, hereditary. They can be caused by certain medications or by trauma or certain medical conditions. But for most people, it's a slow thing that happens with aging, and there's really no way to slow down that aging process.
Well, I'm gonna get there, right?
Yeah. But we're very fortunate that this is one part of aging that we can completely stop and completely reverse. And I am always thrilled by patients' responses after surgery when they come in the next day for their follow-up. And they're like, I have not seen this well in 20 years. I've had patients say, I didn't realize that I have these wrinkles on my face. I just haven't seen them in a long time. Or they can see the leaves on the trees. Or I had one lady say, oh my gosh, my house has so much dust. I haven't seen it in years. I am for the first time just kind of seeing all of this. And that's why I think yes, it's a normal part of aging, but the beauty of this is we can fix it and we can give you vision as good as you had many years ago and without glasses.
So the question would be, if the doctor says you're starting to have cataract, when is the right time to say, okay, do we wait to build up, or do we just get in there and do it because we're going to have to do it anyways?
So I have patients that come in who obviously have cataracts that are just ready to go. You know, they're cloudy, they can't see well. If they were to take their DMV test, they probably wouldn't pass. Mm-hmm. And for those patients, it's simple. You're ready for cataract surgery. Another group of patients, it's a gray zone where they have some symptoms. I can see some cloudiness in their lenses, but their vision is not quite blurry yet. Mm-hmm. And for those patients, it's really a discussion that I have that's personalized and customized for that patient, depending on how much their symptoms are bothering them and how much it's affecting their lifestyle. And it's really a combination of objective and subjective factors that lead me to the decision of, okay, this person needs cataract surgery or this patient doesn't. And then there's a whole other category of patients that don't even have cataracts. Often when you're in your 40s or 50s and your lenses are still clear, your vision is still really good with glasses, but you don't want to wear glasses anymore. Mm-hmm. And LASIK is this whole other procedure that I do that we haven't talked about yet. We'll talk about that later. But LASIK is different from lens replacement. It's just doing a laser to reshape the surface of the eye. But for some individuals, LASIK is not a good option because of their age or because of their eye anatomy. So for those patients, I am doing what is cataract surgery, but without them actually having cataract surgery, just so that we can get them out of glasses. This is a procedure that's commonly referred to as refractive lens exchange. And it's basically removing the natural lens and putting in an artificial lens implant that will allow them to be glasses free. And this is a procedure that is becoming more and more popular. And it's very interesting looking at all the trends that in the last 5 years, there's been a surge of patients that want this procedure because they don't want to wear glasses, but it's a little bit too late to do LASIK at that point. And refractive lens exchange not only gets them out of the glasses, but it's also a permanent fix for their vision. They don't have to go get new glasses every year. They don't have to worry about their vision getting worse as they age, because they've kind of already eliminated the part of the eye that does cause that aging process.
And you're saying it's permanent, meaning
It
you
is.
do this once, and now if you do the cataract where you're changing the lens, and the other procedure where you're also changing the lens, right? The refractive lens.
Yeah.
That means you're good for the rest of your life. You don't have to deal with it ever again.
Absolutely. That's the beauty of it.
Oh, that's the ticket.
Yeah. So the natural lens that we are born with, it has two qualities that make it unique. The first one is that it's clear. And as we age, it gets cloudy, like we talked about. And the other unique quality is that the natural lens that we're born with has flexibility to it. It's gummy and it flexes. And it flexes when we look far and close up. That flexing allows us to see close up without needing glasses. That flexibility starts waning in our 40s. So that's why usually for most people starting their 40s, they start noticing that their close-up vision is getting worse. They have to hold their phone further away from their face and extend their arm further out so they can see close up.
Yeah.
And that is a sign that that natural lens is becoming more rigid. It's no longer flexing. So we start needing reading glasses. But when I do the surgery and I remove that lens and put it in an artificial lens that gives you both far and close up, it's a permanent fix. The part of the eye that is causing the blurry close-up vision is gone. The natural lens is gone with all of its rigidity. It's just no longer working. It's not delivering what it's supposed to do.
Right.
And we are very fortunate that now we live in an age where we have incredible technology that allows us to give patients both far and close-up vision, correct their astigmatism, while maintaining excellent clarity and crispness and colors. And it's a permanent fix.
So here's a question. If our natural lens flexes when we look far or close, so it's adjusting, how does the lens work, the one that you put in that gives you both? And how does it change focus, or is it just focus automatically?
We have several different technologies and subclasses of how these lenses work. The most popular design of these I call them lifestyle lenses in my practice. The most common design is a trifocal lens. So the trifocal lens, the way that it's designed, it has concentric circles imprinted on it. And those concentric circles give the lens that multifocality. With the trifocal lens, it gives you three distances: far, intermediate, and close-up. Far is like reading signs when you're driving or watching TV. Intermediate is like the desktop distance or the dashboard distance of your car. And close-up is looking at your phone and reading a menu. So with the design of those concentric circles on the lens has the ability to split the light beam that is entering the eye into three components and delivering crisp vision at each of these three. Now, people who have worn bifocal glasses or trifocal glasses or progressive glasses, when they put their glasses on, they have to look at the top to see distance and they have to look at the bottom to see close-up. That's not how these multifocal lenses work. With these lenses, it will autofocus far and close-up, so you don't have to position your eye in a certain direction.
Is that because the distance is the light, I guess, comes into the eye differently at a longer distance versus a shorter distance?
The way that you visualize it is different. And the concentric circles on that lens, there are actually different step-offs of powers of the lens. And there are different designs of how these step-offs are made. And we have, slightly different technologies of all these lenses, but these multifocal lenses, they're basically splitting that light that's entering your eye, and so that it's going through different gradations of powers within the lens implant. So that's one technology that's really popular, and I love these multifocal lenses. A different technology that's really popular, and this still blows people's minds when I describe it to them. It's a lens that's called the LAL, or the light adjustable lens. So when I put a lens in a patient's eye, that lens is customized for their eye. And that power calculation is based on the patient's eye anatomy. So when I see a patient for a pre-op prior to surgery, I use very high technology tools, diagnostic tools that measure the geometry of the eyeball. We measure the curvature of the eye, the diameter of the eyeball. We measure all these different anatomical measurements within the eye. I actually put those numbers in formulas, and I calculate the right power of lens implant for every person, for every eyeball. So based on all of these measurements and calculations, we get the power of the lens to be perfect in most patients, where the power of the lens is exactly where it should be. In some situations, the power of the lens could be off a little bit. And that will translate to the patient having vision that's not quite as crisp, or it kind of feels like you got a pair of glasses that's not quite the right prescription. Right. So the light adjustable lens is a lens implant that you do all these calculations, all these measurements, you put the lens in the eye, but then I can use a UV light in the office after the surgery has been performed and the patient has healed, where I shine a UV light at the patient's eye for about a minute, and it actually changes the power of the lens implant while it's in the patient's eye to make sure that the power is perfect and is spot on exactly where it needs to be. So the level of precision and crispness and clarity has just really exponentially increased with this technology, because we can very highly customize every lens for every patient.
That is awesome. That is awesome. Now, here's a question. What if somebody wants to change the color of their eyes? Is this the opportunity?
No, and I get asked this question a lot. So all of these lenses, they're basically replacing the natural lens that's inside the eye. So the natural lens that's in our eye is behind the iris. The iris is the colored part of the eye that is brown or blue or green. So the part of the eye that's colored, the iris, is not replaced. So we cannot change the eye color.
Now, do you still have to wear sunglasses? How does that affect the sun after the surgery is done, after you heal?
Yeah. So we recommend wearing sunglasses in general for anybody who's had this lens replacement or not, to protect the surface of the eye from UV light, just like how people can get skin cancer on their skin, they can get cancer on the surface of the eye or in their eyelids. So wearing sunglasses with UV protection is important for that. But it's also important to protect the inner structures of the eyeball. So with these lens implants, in addition to improving vision and letting you not wear glasses anymore, they actually do have a UV blocking coating as well. So wearing sunglasses wouldn't be necessary to protect the inside structures of the eye, but I would still recommend wearing sunglasses to protect the surface of the eye.
Okay, that makes sense. Yes. So did you want to talk a little bit about LASIK?
I would love to if we have time. Yeah.
Yeah. I mean, because we've talked so much about all these other options and procedures. Let's give them a little bit of information on LASIK and when is the right time to do it and how does it change and everything that you can tell us.
Yeah, I would love that. So, LASIK is a fantastic procedure where we use a laser to reshape the surface of the eye in order to allow patients not to wear glasses or contacts anymore. And most of the time, people say the word LASIK to refer to a big group of procedures that we do that accomplish the same thing. There's LASIK, there's SMILE, there's PRK. There's one procedure that's becoming really popular now called EVO ICL, where instead of somebody putting a contact lens on the surface of the eye, we implant a lens inside the eye without removing anything naturally from the eye. But with all of these procedures, when a patient comes in to see me for a consultation, we do several measurements of the anatomy of the eye. We look at the thickness of the cornea. We look at the patient's prescription, whether they're farsighted, nearsighted, or have astigmatism. And that leads me to a recommendation of which one of these, we call this whole group refractive procedures. So I'll recommend which refractive procedure would be ideal for that patient. All of these procedures are very quick, very safe. They've been around for a long time, and they're able to deliver excellent vision for the right candidate. And this is something that has also been, a true passion of mine because it can really change patients' lives. People who you wear contact lenses, but they can't tolerate them anymore. And wearing glasses is just inconvenient, or they don't tolerate them, or it hurts their nose. Sometimes people have dry eyes or other issues that prevents them from wearing contact lenses every day. To give you just an example from one of my patients, I recently worked with a young tech entrepreneur in his early 30s, building a startup, working crazy hours, like 16, 18 hours a day, and constantly battling glasses and contacts, meetings, travel, late nights. And he came in to see me for a LASIK consultation, and he needed to see, far, close up. He needed to spend long hours on the screen. And we were able to deliver that for him with LASIK. And he made this comment to me. He's like, I'm on the computer doing Zoom meetings all day, and he's like, I keep pushing my glasses up, and there are no glasses anymore. Or reaching out for lubricating drops, and there are no lubricating drops. So, it's just having that clear vision is not just about the convenience, but for some people, it really affects their confidence, performance at their job, and just many moments in their lives that we can help them be more successful.
And then one last question. When you do either of these two procedures, do you do both eyeballs the same day, or do you do one and another one?
With the first procedure we talked about, which is replacing the lens, whether it's cataract or refractive lens exchange, I do it one eye at a time, usually a few days apart. When I do the refractive procedures like LASIK or EVO ICL, I do both eyes on the same day. And
how long is the recovery for each?
Very quick. Patients can see fantastic the next morning. The first couple of days, there could be a little bit of dryness or a foreign body sensation. By 1 week, most patients feel like their eyes are back to normal.
Nice. That's really cool, because that way you can get rid of the glasses. Wow. Okay. Wow. That's like so much good information for us to understand more about our vision and why we need to start using glasses once we hit our 40s. That you fight it, get that phone farther away, get that menu farther away, and then it gets too far. Now you can't see it because it's too small. So now you have to wear the glasses, right?
Right.
So that's, and then in the different procedures. So anybody who's listening and you need to fix your eyes, there you are, a whole menu of different ways and how to do it. So thank you so much for sharing all this with us. And if somebody is listening and they would want to get a hold of you, how could they get a hold of you?
So, two ways. Our website is envisioneyecenters.com, or you can even just simply Google my name to find the website. My last name is Raoof, which is Raoof. And the other way, you can also find me on Instagram. My name is Raoof and I post a lot of content there too about my patients and the technology that I use. And my website will be on there as well.
Well, thank you so much, Dr. Raoof, for joining us again. And to our audience, please go to ocpowerplayers.com and follow us on your favorite channel. And once again, thank you for sharing.
Thank you. It was my pleasure. Appreciate it.
Thanks for listening to Orange County Power Players. Want to share your success story? Apply to be a guest at ocpowerplayers.com/guest.